And they found after birth, the infants of depressed mothers had higher norepinephrine and cortisol compared to the infants of non-depressed mothers. And this translated into sleep problems, more sleep disturbances, and less time in deep sleep compared to infants of non-depressed mothers. Honestly, physiologically, that makes total sense, because what you're having is an exposure to stress hormones, which actually leads to a state of a chronic hyperarousal. Okay, so we find that there are actually other factors here that we need to consider. And so again, these sleep training models are just very, very, very limited and simplistic. We just have a lot more research on other things that influence infant sleep. And again, if we're going to try to evaluate the effectiveness of any of these techniques, we really have to take some of this into consideration. Okay, so we're going to kind of look at a couple of things. First of all, this was actually kind of an interesting review here that was done by Dao and Liu in China. But they actually said that they reviewed 40 different studies from children 0 to 5 and found that the risk factor for poor infant and child sleep can be grouped into 5 domains: biological, psychological, family, environmental, and sociodemographic. Okay, so the biological factors that include infant and child sleep are temperament, prematurity, and some medical conditions. Yes, absolutely. Totally agree. Psychological effects also include child anxiety, sensitivity, and parental mental health, especially mothers. Okay, so again, that's that kind of bidirectional relationship. And also, too, thinking about kind of, does that child feel secure? That's one of the big factors here. Okay, the family factors include inconsistent bedtime, co-sleeping beyond infancy, negative parenting behaviors, and attachment security. Okay, so insecure attachment were linked to shorter sleep duration and more nighttime awakenings. And they said this was actually the most robust factors. And finally, they found environmental influences, including screen time, household crowding, secondhand smoke, and noise, and socioeconomic disadvantage. But they found less stable home life and parents' limited resources. But again, I think that's just partly a marker for parental stress overall. So you see, it's a lot more complicated than just don't answer your baby's cries and they will learn to do this. That there's a lot of things influencing infant sleep, and we need to kind of consider those. Okay, so one of the factors, and a couple of the studies have hinted at this, is there's some prenatal factors that are related to infant sleep. Okay, and so again, this kind of shows that kind of bidirectional relationship between the mother's mental health and the infant's sleep. And we're talking about prenatal exposure to the mother's depression. So what happens prenatally is then the babies then are exposed to the mother's stress hormones, particularly norepinephrine and cortisol. Okay, so norepinephrine is the stress hormone from the sympathetic nervous system. Cortisol is the end state of the hypothalamic pituitary adrenal axis. Okay, both stress hormones, 2 different systems. Those are the ones that are studied. Okay, so this one I thought was actually very interesting. This was a recent one, 2023, Matt and Chuck, and it's from Canada. So they had 403 mother-infant dyads, and they were part of a longitudinal study, the Canadian Healthy Infant Longitudinal Developmental Study. Okay, and they found that higher prenatal depression scores were associated with shorter nighttime infant sleep duration, but interestingly, only for babies born vaginally. Okay, so it's like, why? Why would that be? And they said they thought, this is what they hypothesized, that it could be because of their vaginal birth that they were exposed to the mother's microbiota, which they would be being born vaginally, which generally we think is a good thing. Okay, but that was just kind of one of their theories. Okay, a study that was actually done in 2007 by Tiffany Field and her lab actually looked at 253 pregnant women, including 83 women who were depressed. And they found after birth, the infants of depressed mothers had higher norepinephrine and cortisol compared to the infants of non-depressed mothers. And this translated into sleep problems, more sleep disturbances, and less time in deep sleep compared to infants of non-depressed mothers. Honestly, physiologically, that makes total sense, because what you're having is an exposure to stress hormones, which actually leads to a state of a chronic hyperarousal. Okay, this is actually a similar finding from the Avon longitudinal study of parents and children, also known as the ALSPAC study. This has been a huge study that's been going on for like 20 years, and they actually have collected all this data, and now they've got kind of the next generation. And so they were looking at 8,318 infants assessed at 18 months and 2,241 at 24 months. And they found that antenatal depression at 18 months led to shorter sleep duration at 24 months compared to infants of the non-depressed mothers. So again, you see that pattern of that prenatal exposure to stress hormones through the mother's depression actually led to infant sleep short times. Okay, so you can kind of see how this gets to be bidirectional. Mothers are depressed prenatally, their babies come out more sensitive and more aware, and they don't go into deep sleep because of kind of a chronic hyperarousal. Okay, and because of that, then they don't sleep well, which then contributes to the mother's depression. So again, it gets to be in this kind of very bad kind of downward cycle. Okay, so what people kind of coming from the attachment theory perspective look at is what they call relational interventions, which are aimed not to extinguish infant sleep, but to improve maternal sensitivity, responsiveness, and parent infant attunement. So they're basically teaching the parents to be aware of the baby's needs. And this is also partially based on ethology, because again, it's kind of like the baby is saying something to you. What do you need to know? Okay, so they kind of said that you can understand, they want to help parents understand infant cues and regulate sleep through shared routines, environmental adjustments, and co regulation. Okay, so the idea is that particularly in infancy, you know, babies need an adult to help them regulate strong emotions. So when they get very, very upset, they need an adult to kind of be with them so they can kind of start winding that down. Okay. And if they don't, it just seems to ramp them up if they don't have that. So that's that kind of approach. And they said these programs reduce maternal distress, enhance attachment security, and foster parental self efficacy. So the parents feel like they know what they're doing. Okay, so they did a pilot study of 57 parents who reported that their infants cried excessively at 6 months. They actually did just a very simple intervention. They just kind of educated parents with a booklet called Surviving Crying. Okay, and they had a home visitor come in, and the focus was to change the perceptions about infant crying and give them tools to cope. Okay, so they didn't recommend changing the infant's behavior by influencing or reducing the amount that they cried, but what they wanted to do is help the parents be responsive to that. Okay, and they actually found that the families and the home visitors found this actually a very feasible method to use. Okay, so that was just kind of the pilot study. So let's take a look at what other things people have done. Another study looked at treating and supporting mothers when their babies had excessive crying rather than extinguishing the infant behavior. Okay, so that was Montessori in 2018. They said that when infants cry a lot, you can prevent depression and anxiety by treating the mother rather than forcing the infants not to cry. So their approach was if you treat the mother's depression and anxiety, the baby is going to pick up on that and they're going to downregulate and they're going to cry less. Because again, remember, it kind of goes into that cycle. And so they said the maternal psychological stress can perpetuate infant regulatory difficulties in a negative feedback loop. Okay, and again, that's this idea that mother's depression, causes the babies to be kind of in that state of chronic hyperarousal, which means they don't sleep, which means they cry, which then can increase mother's depression. That's the negative feedback loop. Okay, so what you want to do is help them kind of get out of that. So what they did in this study is it was a randomized controlled trial. They assigned 30 mothers to an intervention group and 30 to standard pediatric practice. In the intervention group, the mothers got 8 weeks of behavioral therapy that included emotional regulation, stress management, cognitive restructuring, and problem solving to manage infant demands. So, in other words, they taught them, okay, baby's telling you something. This is kind of how to respond. And, I think part of the problem is a lot of times when babies are crying a lot, mothers are like, what's wrong with you? Everybody else's baby is not crying as much, and they don't understand. They start kind of, you start ruminating, going round and around and around, start thinking, what's wrong with you? And this approach was to say, no, baby's telling you something. Baby may be sensitive. They may be kind of highly sensitized. Sometimes you have that baby with a very sensitive temperament, and they kind of need some certain amount of emotional regulation. Okay. And so that was the kind of the idea, is to kind of think about this differently. And they found that mothers in the intervention group had significantly lower anxiety and depression compared to the mothers in the standard pediatric care. Okay. So another study included 190 moms and their dads with infants 12 to 24 months old. And they found that, really kind of looking again at the parents who had more trouble regulating their emotions, the more infant sleep problems increased. So again, kind of thinking about the parent. And they said this effect was only a problem, though, when attachment security was low. Okay, when infants felt securely attached, even if the parents were kind of having problems with depression, anxiety, um, they were okay. But if there was an insecure attachment and the parents were dysregulated, then the infants actually had a lot of sleep problems. And they said secure attachment mitigates the effects of parental emotional dysregulation, and a secure attachment regulates infant sleep. So again, it really comes back to, remember, proximity and responsivity, the two sort of pillars of building a secure attachment. We want to have that. Okay. And another one looked at 80 mother infant dyads age 1 to 24 months and finding that emotional availability at bedtime was associated with more positive infant affect and fewer bedtime struggles. If mothers were sensitive, their infants had more positive or neutral infant distress behaviors, such as crying or protest. Okay, so maternal sensitivity led to less crying, and higher emotional ability was also linked to shorter sleep onset latency. That's the time it takes them to go to sleep, and fewer parent reported night wakings. So again, it really seems that this is the absolute opposite of sleep training approaches. This is not try to force your baby into something. It's have the mothers pay attention, be sensitive to their baby, be there, be available, and the babies are going to actually get into the rhythm and sleep better. So it kind of really flies in the face of that. Okay, and finally, one other study in this section that's kind of really, again, related to particularly attachment theory is looking at 148 children 3 to 5 years. This is from 2019. And they found that higher maternal emotional responsivity predicted more consistent and calming bedtime routines, which were associated with fewer sleep problems, including shorter time to fall asleep. Emotionally responsive parenting fostered positive sleep behaviors, not by directly altering children's sleep patterns, but by shaping the bedtime environment in which the sleep habits were formed. So again, this was a kind of a shift. So instead of forcing the baby to do something, they were actually recommending that the parents be responsive and have regular routines, and have a calming environment, and this one is actually for children. So 3 to 5 years old, and that you actually had fewer times of sleep problems. So again, it really does argue quite strongly against this idea that you just let babies cry and you ignore them. Okay, so I want to mention another variable, which I think is super important, and that is feeding method. None of these studies include that, and one of the things that we found over the last 10 years or so is this is intricately related to both mothers and infant sleep. And this kind of really comes again more from that ethological perspective as well as the attachment perspective. In other words, babies are signaling what are they trying to say and what's important here. And is fragmented sleep actually better for babies? And that's kind of the argument that fragmented sleep may be the thing that saved them from SIDS. Because one of the theories of SIDS is that babies get into such a deep state of sleep that they can't rouse. And if they can't rouse, then all of a sudden we find that they are having, they get into such a deep sleep that some of them die. And so the argument goes that the fragmented sleep serves a really important beneficial purpose. But then we toss in feeding method, which is another thing that, when you talk about preventing things like SIDS, exclusive breastfeeding cuts the rate of SIDS in half. So again, very important, but it also has kind of this kind of day-to-day function in that it actually improves sleep. Okay, so we don't really talk very much about infant feeding method in these sleep studies, but it's relevant to both and maternal mental health. Okay, so the first study that came out, and this was just kind of mind-bending when it did, was a study of 133 mothers and fathers at 3 months postpartum. Exclusively breastfeeding mothers slept 40 minutes longer than the mixed or formula feeding mothers. So again, this just kind of blows away all the thoughts. And these are thoughts I had too. I really assumed that exclusively breastfeeding mothers slept less, but they don't. They actually sleep more, which is just kind of runs counter to everything, we kind of think. Because that's always the argument, especially when you talk about maternal mental health. Don't feed the baby at night, because if you do, you're going to actually have postpartum depression. But the argument is these mothers are actually getting more sleep. So then Dorham came along and did a much larger study, and this was published in a sleep medicine journal. So in 2009, and it is 2,830 mothers at 7 weeks postpartum. Now, they found, not surprisingly, that poor sleep was a risk factor for depression. Yeah, that's kind of what we're saying. Poor sleep is. But here's the interesting thing. The factors that they found that were related to poor sleep included depression, okay, because depression changes their sleep, but also previous sleep problems, being a first-time mother, a younger or male infant. That's kind of an interesting thing in these studies. The younger infant, I assume they're referring to the late preterm infants, which, those ones that are born about 37, 36 weeks. They look like full term, but they're not quite, and they tend to actually go to sleep quite easily, during feeding, and so they're waking up every 20 minutes because they didn't get enough to eat. That's one thing, but for some reason, male infants actually do seem to be more sensitive. That's come up in at least 5 studies that have looked at that. There does seem to be a greater sensitivity of male infants. And again, that might be protective because we know that there's a slight increased risk for males dying of SIDS. So again, that sensitivity might be a function that actually protects them. Okay, but then here's the other one that I think blows everybody away. The thing they found that was a factor associated with poor sleep was not exclusively breastfeeding. So, in other words, if we're going to get away with a double negative, exclusively breastfeeding led to better sleep, which led to lower risk for postpartum depression. They found the same thing as DOM. Okay, now we kind of came along in 2011. That was the first paper we published on this, and looked at 6,410 moms who had infants 0 to 12 months old, and it appeared that infants slept longer with exclusive formula feeding. Okay, so you're thinking, oh yeah, okay, there you go, that's what we want, right? So when you first look at this data, it looks like it's going to contradict those previous 2 studies, okay, because the formula-fed babies slept much longer, 7.7 hours at their longest stretch, compared to exclusive, which was 5.5. Okay, but also the formula-fed infants woke up less often. It 1.39 versus 2.5, okay, times per night. Okay, so again, you'd look at that and you'd think, okay, yeah, that's it. That's why we should formula feed. Okay, but here's the thing. When we looked at all the important sleep variables, particularly the ones that predict postpartum depression, we found that the exclusively breastfeeding mothers, first of all, reported longer total sleep time, okay, than any of the other groups. There was no significant difference between mixed and formula. So it appears that this is some kind of threshold. And it's amazing. The studies have been really consistent about this. Okay, but also they took fewer minutes to go to sleep. Okay, so those are the 2 big predictors of postpartum depression. Okay, longer self-reported sleep time and fewer minutes to get to sleep. So anything under 20 minutes is considered low risk. 25 minutes and above is high risk for depression. And it's really been very, very consistent across a number of sleep studies. Okay, so those 2. So those were better with the exclusively breastfeeding moms, significantly better at the 0.0001 level. But also that translated into better levels of daily energy and physical health, and lower risk for depression. And one thing I want to kind of say about the energy is, people say a lot of times they kind of misunderstand what I'm saying here. And they say, well, yeah, but I exclusively breastfed and I was tired. Well, it's not a question of being tired. It is still postpartum and it is still hard. I mean, this doesn't make that all go away. But the question is, would you be more tired if you started supplementing? And the answer is yes. Yes. You report less energy. When we talk about the energy levels, of the exclusively breastfeeding moms, there are 3 on a 5-point scale, but everybody else was significantly lower than that. Okay, so you see, it's just very, very, very consistent. We were actually really surprised how consistent it was. Okay, so a study from China actually found very similar results, and they actually came up with sort of three things to actually, possibly explain this. And they said, first of all, that there was melatonin in human milk, which may reduce fragmented night sleep for infants in the first few months postpartum. Okay, that was hypothesis number one. Hypothesis number two is had to do with the mother's intestinal microbiota and the circulating microbial metabolites, which increase sleep through modulating the microbiota gut brain axis. Okay, but the net result is it reduces activity of the hypothalamus pituitary adrenal axis, which is long way of saying reduces that, sort of chronic hyperarousal, chronic stress activation. Okay, and then the third one, and I think actually it could be all of the above, is that breastfeeding mothers spend more time cuddling, soothing their infants compared to mixed or formula mothers. And they said skin to skin contact also could increase infant sleep. Yeah, it makes total sense, for mothers and babies, because what does that do? It releases oxytocin. Okay, and we know that that downregulates that stress system. Okay, so what's kind of interesting is another study that just came out in 2021 from Newman. They looked at 152 mothers at 6 months postpartum or younger. Okay, and actually, what they found was that breastfeeding was not associated with maternal sleep quality or depressive symptoms, but sleep location was prominent. And they said mothers who bed shared had significantly poorer sleep and more depressive symptoms. In contrast, room sharing without bed sharing did not influence outcomes. Okay, so here's a couple of problems. And again, this is why you always need to look at the methods section. Okay, first of all, how did they define breastfeeding? They did not distinguish exclusive versus mixed. And all those previous studies showed you there's a difference. Exclusive is unique. Okay, so exclusively breastfeeding does this, mixed feeding does not. So if you got a group of mothers and you don't know, of course it's going to muddle the findings and kind of make it worse. And not only that, but they looked at sleep location. And again, since they did not distinguish between mixed and exclusively breastfeeding mothers, they concluded that that was actually led to poor outcomes. So in their view, this was a problem. Bed sharing actually caused all kinds of anxiety. Okay, so let's take a look at another study that we did. Okay, so it was based on our data. Okay, and what we found was that actually sleep location, we looked at sleep location versus exclusive versus non-exclusive breastfeeding. So was the baby in the bed or not? Okay, so it was kind of a 2x2 analysis. And what we found is that the mothers who get the most sleep are the ones who are exclusively breastfeeding and bed sharing. And certainly many mothers would tell you this. And their depression and anxiety and everything was lower than everybody's. Okay, however, the mothers who were partially or mixed feeding and bed shared, their anxiety and depression did go up. So you can see how just not making that distinction between exclusive and mixed made a huge difference. Okay, so they found that. Okay, and so that was actually really important, is like you've got to look at both the sleep location and the feeding method. Those things are both relevant. So again, that gives you an idea of kind of like if you don't consider that breastfeeding variable and exclusive versus mixed makes a difference. Okay, so finally, there was just one other kind of group of really recent studies, and they kind of tackled the question, does breastfeeding cause fragmented infant sleep? And this again, they viewed as a problem. Fragmented infant sleep is a problem. And instead of looking at it from the ethological thing, is it actually protective? And do those babies actually need to eat at night? And the answer is yes. Yes, of course they do. But they looked at, does breastfeeding cause a problem because it causes fragmented sleep? In other words, what's the effect of breastfeeding on long-term sleep outcomes? So the first study was a big study from China, 4,085 Han Chinese, and they followed them from 3 months all the way up to 24 months. And they found that there was fragmented sleep during exclusive breastfeeding. However, exclusive breastfeeding was associated with longer and better sleep trajectories during the first year. So even though there's fragmented sleep when they first measure it, overall, when you start getting toward 12 months, their sleep is better. Their sleep is better. Okay, so you don't necessarily have to deal with that fragmented sleep. And infants who were not exclusively breastfed had shorter sleep durations and trajectories at 3, 6, and 12 months. So again, this idea that if feeding formula, not responding to baby is going to create these longer sleep outcomes, that is actually not what this study found. This study found the opposite, that fragmented sleep during exclusive breastfeeding actually did lead to better sleep outcomes. And again, looking at this from the ethological perspective, that makes perfect sense because we would look at this as a survival mechanism, which it is. Okay, so another study in Canada, actually also a very similar kind of thing they looked at. So they had 444 Canadian mother-infant dyads. They looked at this over the first 3 years. They said breastfeeding was associated with more infant sleep fragmentation at 6 to 12 months, but did not affect total sleep duration, nor did sleep fragmentation persist into later infancy. And they actually recommended that parents not hesitate to breastfeed because they were concerned about infant sleep problems. Okay, so again, this thing really contradicts a major premise of sleep training, is that non-responsive care leads to better infant sleep. It's absolutely the opposite, because particularly to maintain exclusive breastfeeding, there has to be responsive care. It has to be. And again, looking at that from the ethological perspective, does this aid survival? And a lot of the sleep researchers would say absolutely yes. Okay, so, what can we conclude from this? First of all, um, infant sleep can tell us about why infants need to grow and thrive, and could fragmented sleep protect infants and lower the risk. And certainly anthropology researchers like James McKenna, Helen Ball, actually would say absolutely yes. And as for infant crying, the question really I think is raised from these different studies is it more effective to educate parents about why infants cry and to support them as they cope with this challenge? And that really seems to be the way a lot of these studies have gone. The studies, a lot of times, that set out to look at infant sleep end up eventually incorporating a lot of the attachment ethological perspective. So even though they're kind of like looking at a behavior that's primarily behavioral, they actually are supporting more of an ethological and attachment perspective. And also too, there's just a lot of methodological problems with the studies that do look at sleep training. And again, this is why you have to critically read them, because oftentimes there's many, many, many problems. Inconsistent interventions. Parents get to define their own intervention. I mean, who's ever heard of a behavioral study like that? It's kind of insane. They don't have a control group, so they can't account for developmental differences. And importantly, and this is a big one, they don't a lot of times do long-term follow-up. Oftentimes when you look at ones that say, oh, there's no harm, then you look and 30% of their sample is dropped out by the end point. And you find out that those are the babies that are at higher risk, and in fact are the ones more likely to be harmed by these approaches. So this is something that's good. So it's like, instead, we have actually kind of as a field, I was pleased to see, moved in a much more productive direction, which incorporated both attachment and ethological models. And we accept sleep the way it is, help parents meet the nighttime needs, and obviously provide support, because it is challenging, but kind of like talk to them about how can we make this easier for you? So again, it's this idea of kind of individualized care plans. And mother-infant sleep researchers, by and large, have rejected sleep training in favor of more developmental and compassionate approaches. So that's it kind of in a nutshell. I'm going to actually put this chapter up on ResearchGate so you can look at the whole thing if you'd like. So if you go to my account, Kathleen Kendall-Tackett, at researchgate.com, it will be posted. I'll post it up there today. And the chapter is called A Critical Review of Cry It Out, and it's going to be part of an edited book by Jenny Rosier. So it's going off to the publisher. It's going to be published by Routledge, and I think actually we're real excited about this. So keep an eye out for the book. We'll post some kind of notice when the book is actually finally out. And I want to say thank you for listening today. And again, like I said, I'm going to go ahead and post that book so you can see all the references for yourself. Take a look. I encourage you to take a look at the studies, see what you think. But what I'd really strongly encourage you to do is look at these studies and don't just think just because they say their results are what they are. Take a look at their methods. What did they do? How did they define this? How did they define infant sleep? How did they define their intervention? Because oftentimes you find there's some really significant problems. And especially before we start recommending any of these techniques to parents, I think it's really important and appropriate that we do that. So with that, I'm going to say thanks for tuning in. I hope to see you the next time, and be sure and like us, recommend us to your friends. Thanks again. Bye.